Let's define scoliosis in under 2 minutes. A healthy spine is straight and upright. Scoliosis is a sideways curve, greater than or equal to 10 degrees, plus rotation. Double curves are less common. About 3% of kids are affected, mostly girls. It's often found during puberty growth spurts. Family members have an 11% risk. Genes matter, but it's not straightforward. Curves grow fastest during rapid growth. Timing helps guide treatment decisions. Pain is rare in teens with scoliosis. If there is pain, doctors look deeper. Key traits: curve, rotation, growth risk, low baseline pain. Structural curves don't straighten when bending. That's what separates scoliosis from poor posture. Rotation can cause ribs to stick out. Even painless curves can grow. Watch for uneven shoulders, ribs, or hips. Teens may feel self-conscious, but support helps. Most cases are managed without surgery. Next, how we spot and grade the curve.
Detection begins with what you can see. Scoliosis screening starts by checking body alignment. Look for symmetry in your reflection. Raised shoulders or uneven waistlines can be clues. You might also spot a shift in the waist. The Adams forward bend test is often used in schools. Bending forward reveals rib asymmetry on one side. A scoliometer reading over 7 degrees prompts radiography. From screening to imaging, next comes confirmation. Modern X-ray systems are safe and effective. These systems use ultra-low radiation. It delivers about 0.05 millisieverts, less radiation than a chest X-ray. Now we measure how much the spine curves. We draw lines to measure the Cobb angle, the key metric for treatment. Less than 25 degrees monitor. 25 to 45 degrees, brace. 50 degrees or more, surgery. Bracing helps control moderate curves. Growth matters too. Maturity predicts change speed. A RISR 0 to 2 skeleton grows fastest, so curves shift more. A 30-degree curve in RISR 0 has 60% chance of worsening. Severity, age, and growth rate shape our decisions. The goal? Early detection and timely action.
Scoliosis care follows a 3-tier ladder. The rungs are observation, bracing, and surgery. We begin with observation for smaller curves. Curves under 25 degrees are reviewed every 6 months. These reviews include clinical exams and radiographs. Children can stay fully active during this phase. There are no restrictions on physical activity. So what are the outcomes with just observation? Evidence shows 80% of small curves remain stable. If the curve progresses past 25 degrees, we brace. Bracing is used for curves between 25 and 45 degrees. The TLSO is the most commonly used brace. It's custom made for each child's spine. Patients wear it 18 to 23 hours per day. Bracing reduces progression risk by 72%. New braces include smart sensors to track wear time. If the curve exceeds 50 degrees, surgery is considered. This is because larger curves can affect breathing and heart. The most common surgery is posterior spinal fusion. It uses rods and screws to realign and stabilize the spine. Some families choose vertebral body tethering, or VBT. VBT preserves motion, but has a 15% revision rate. Surgical patients walk day 1, return to school by week 2, and resume sports by month 3. Whichever path you take, today's care keeps spines and lives moving forward.